Okay. Well, we're just live right here.
Hello.
And we're going here in three. Taking connection. 2, 1, go.
It's Dr. Vidal, and we are here at Pure Plastic Surgery with our weekly live Tuesday tips. Welcome. Thank you for joining. This is our weekly check-in. We try to discuss topics in plastic surgery every Tuesday afternoon, and I get to answer your questions. And I am starting this week with a series. So it's going to be called What to Expect, and I'll be talking about different procedures, okay? So it's going to be a couple of weeks of every week what to expect and a different surgery. We're going to start today with what to expect mommy makeover. Why I decided to do this. So I know I talk a lot about the procedures, the surgical part. I talk about the recovery, like focusing on the medical aspect of things a lot. But I see a lot of patients that come back and complain or mention several things that were a little bit harder for them in the recovery because they were not expecting that. And those things are usually very common in the majority of the patients. So for example, for mommy makeover, we're going to see that a lot of the patients that go through mommy makeovers experience these few things, and I'll go over them so to explain to you why you go through them, what's the reason behind it, and also how to prepare so it doesn't take you by surprise and you come prepare for your surgery and your recovery is smoother. So let's start with mommy makeover. What to expect after mommy makeover. Mommy makeover is a combination surgery. We call it mommy makeover because pregnancy usually affects or alters your breast and tummy. So a mommy makeover is a procedure that targets those two areas. It depends on what you need in the breast procedure. It may be just a breast augmentation, it may be a lift, it may be a reduction, or a combination of a lift and augmentation. And that procedure, the breast, whatever you need in the breast, combined with a tummy tuck, okay? So what to expect afterwards depends on a lot of the breast procedures, depending on what you're gonna experience, but these are the common things that I hear and week after week I hear my patients saying like, this was helpful for my recovery. So let's start with hydration. Hydration is something that is going to be super important, and this is going to be, I think, my first one in every what to expect, don't matter the surgery here. I'm going to start with the hydration. Hydration is key for your recovery. Surgery itself dehydrates you. It's a combination of you have to be NPO or nothing per mouth 8 hours before your surgery. So you come in with an empty stomach for the anesthesia, but also behind in your fluids. Then during the surgery, you lose blood, but also we lose fluids. When our body is open during the procedure, there's something called insensible losses, which is our skin protects us from that. Because our skin is impermeable, so it's protecting us from insensible losses. But when you have a cavity open, the breast open, the belly open, those insensible losses are higher. So even though we give you IV fluids during the anesthesia and during the procedure, you're still behind, okay? So when you go out and go back home or the Airbnb or wherever you're staying, you should focus on hydration. At least 1 gallon of fluid a day. Why 1 gallon? I think 1 gallon, it's like majority of patients depend based on your weight and height are gonna need that amount to replenish the loss that you had. But it's a little different for everybody. So if you are a person that usually drinks a gallon of fluid a day, then you might need 2, okay? So it all depends on what is your baseline fluid, and also, for example, my bariatric patients, sometimes 1 gallon is too much, and you have to adjust it to what you can tolerate. But definitely try to be sipping constantly, especially those first 1 to 2 weeks, okay? In hydration, I want to also mention the diet, okay? So it's very common what to expect after a mommy makeover. You're going to feel full, okay? Remember that with the tummy tuck, I do the muscle repair, and with the muscle repair, everything is cinched in and tight. So it's like a constrict, and you have a binder on top of that. So everything that you eat, even like a small amount, is going to feel that you're full, okay? So you're not going to have a lot of appetite. My recommendation is soft diet so you can get more in. Try to prioritize healthy okay? If you eat a couple of French fries, it's not gonna be nutritious for you. So you're gonna be able to tolerate just a small amount. So try to be veggies, try to be charged in nutrients for your recovery. Low in salt, because if you eat salty, you're gonna get very swollen, okay? And the other thing is protein shakes, okay? Like Ensure, those help to get your calories in, because you're not gonna have a lot of appetite, okay? What to expect? Position. Your position is gonna be hunched over, okay? And for sleeping, you can't be flat completely, okay? So prepare to either have a recliner where you're staying, or a lot of pillows, so you can put pillows under your legs and back, okay? So you can sleep with your hip flexed, a little bit sitting up. It doesn't have to be like all the way, but just recline. We call it beach chair position, okay? So a little flex in the back and in the legs, so your knees are flexed, okay? So recliner, or there's something called wedges that you can find online, and it's basically like a big triangle that you can put in the back and in below your legs, and kind of makes that position like this, okay? Like your hip is flexed this way, okay? So the wedges are a good alternative. They even sell the wedges inflatable. So like if you need to travel, you can collapse it and then inflate it where you are and then use it. Extra pillows if you prefer to be in bed, but recliner is a good option too for the first few weeks. A walker, it's helpful for some people. I don't think you need a walker for your mommy makeover, but a lot of people feel more secure because you're going to be walking bent over like this to avoid tension on the incisions. So a walker gives you more support, and that's completely up to you, but have a lot of patients that have told me that they feel a lot better using the walker, okay? Wound care, what to expect with wound care? There's not much wound care involved. All the incisions are going to be closed with absorbable sutures. So all of the sutures are on the inside. Only 2 sutures are going to be on the outside that you're going to have to remove eventually are the sutures holding the drains. I put 2 drains for the tummy tuck in the corners of the incision. So those drains are secured in with stitches. So those are the only ones that are the outside. The rest of the incisions of the breast, the tummy, the belly button, all are absorbable on the inside. All of the incisions are going to be covered with steri strips, which are like little tapes. Those steri strips stay on for 2 weeks, okay? So there's not really a lot of wound care. The only thing that you're going to have to clean is your belly button, okay? The belly button is going to be covered with a little gauze, okay? And the next day, when you call us for a video call follow-up, we're going to instruct you how to remove that little gauze. And then you're going to use hydrogen peroxide with a Q-tip and gently, you don't have to shove it in, just gently on the outside. The hydrogen peroxide helps get out the crust that sometimes forms after dry blood. It's like desiccated in the scar. So that kind of dissolves those scabs and kind of cleans it up. And then you're going to apply antibiotic ointment. You can use bacitracin or mupirocin, whichever you prefer, and you're going to put just a thin layer over the incisions in the belly button, and that you're going to do for the first 5 days. So after the first 5 days, after shower, you're just going to pat dry. You can use still the Q-tip if it's too deep and you can't reach to clean it with the towel, and then you're going to apply antibiotic ointment, okay? After 2 weeks is when you start scar treatment, okay? So at 2 weeks, you can remove all the tapes and start scar treatment everywhere. The one I recommend is silicone-based scar products. Those are the ones that are been approved by the FDA and also proven to be helpful and beneficial for scarring, okay? Surgery is in the T-point. So the breast lift, most of the breast lift incision is going to be an anchor, so around the areola, down and across the bottom. This is terrible drawing here. Wait a second. Terrible. Here and across in the bottom, okay? So where the 2 incisions meet down here, that's the triple point, okay? So that area, all the tension of the closure is there. The 2 incisions need to get areola meets the version. If you see anything like that, just give us a call, send us a message through a picture, and I send you an antibiotic ointment called Silvadine. And the wound care consists of cleaning with saline, applying a thin layer of Silvadine, covering with a gauze, and just putting your bra back on, okay? And that you're going to do twice a day, and it usually takes a couple of weeks to heal, and it heals on its own, okay? The other thing that you may experience wound care related is spitting sutures. So spitting sutures may happen a couple of weeks after the surgery. I mentioned that all the sutures are absorbable, right? But they're absorbable in 3 to 6 months, okay? So it takes time for the body to dissolve them. And the body may do one or two things. One, dissolve it and absorb it, or dissolve it and pop it out, okay? So if you see it, you're gonna notice like a little bump. It looks like a pimple in the incision. It may be a little irritated red around it, but it's like a pinpoint thing, and when you touch it, you may feel like a little suture, okay? If you do, once you see the suture, you clean it with alcohol, take a tweezer, pull this stitch, and that's it. And then you put in a antibiotic ointment, and it heals, okay? So don't be scared. Again, any of this, you're gonna give us a call, or you're gonna send us a message, and we're gonna guide you. I'm just explaining to you what to expect, okay? So the other thing is back pain. The majority, I would say 99% of the patients say, I don't have any pain in the belly, any pain in my breast, I just can't take my back pain. The reason for that is the position, okay? Remember, you're gonna be like this for 2 weeks, okay? So the first few days is fine, but then you're gonna feel the urge to straighten your back. And the problem is that puts tension in the incision, okay? So what things help? Some people say that the walker helps them, okay? Because that's giving you support, so you don't have to be like holding your back in that position. You can rest your arms in the walker, and that gives them a relief. Lidocaine patches help a lot, okay? Those you can put on the counter in the pharmacy and put it in the lower back, okay? And 2 days after surgery, you can start taking NSAIDs or ibuprofen, Motrin. Those help with muscle pain a lot more than Tylenol and Percocet. So after 2 days, you can start with NSAIDs, and that usually helps a lot with the back pain, okay? Nerve-related pain is very common after tummy tuck. After tummy tuck, because if this is the belly, below the belly button, this area here is going to be very numb, okay? Because all the nerves are coming from the top, okay? And they have to kind of get and reinnervate that area down there, okay? So you may feel itching, like pins and needles, crawling kind of pain. That's very normal, especially in this area and in the areas of liposuction, okay? Wherever you have liposuction, those nerve endings, especially like a week or 2 out, start to kind of grow again, and you feel those itching, stabbing, all of that is completely normal, goes away with time. Sometimes using Benadryl helps a lot with that kind of pain, okay? Constipation, I think this is the most common. After the back pain is the constipation after surgery. Expect constipation after a mommy makeover. I recommend starting your stool softeners the day of surgery, okay? Even if you're not a person that usually gets constipation. Why? It's a combination of the tightening of the muscle, okay? Everything is gonna be super tight. It's gonna be sore, so you're not gonna want to push, okay? And if you push, you're gonna feel like everything's just like torn apart. So everything should be as smooth. So try to take the stool softeners since day one. And the other reason is the Percocet. Narcotics cause constipation, okay? So what's gonna help? The stool softeners since day one, hydration, and try to incorporate in your diet fruits and supplements that help you with your bowel movements, like, you know, papaya, like bananas, anything that helps move the bowel, okay? So expect to be a problem and target it ahead of time so it's not a problem for you, okay? And plan ahead for the recovery, okay? Recovery for a mommy makeover, I put 6 weeks because that's when the majority of the restrictions are gonna be held. Restrictions meaning not lifting anything heavier than 10 pounds, no working out, no submerging in water, so no pool, beach. So don't plan a vacation before 6 weeks after your surgery, because you won't be able to do much, okay? You are going to be wearing a faja 23 hours a day, okay, with phones. So plan ahead for a good sitting, like resting and recovering for 6 weeks. But still know that the swelling may linger for 3 months, significant swelling, and then up to a year, minimal swelling that comes and goes, okay? So that's the majority of the patients see a decrease in the swelling by 6 weeks, another marked decrease in swelling by 3 months, but they may still experience some fluctuations up to 1 year after surgery, especially in the belly. The belly tends to swell more than the breast, okay? The breast is the implants. The implants need to drop and round at the bottom of the breast, so that takes 6 weeks to 3 months to happen, okay? So I'll take some questions now, and it will be helpful if you had a mommy makeover already and you experienced something that can be helpful for someone else and I didn't mention. Please send me a message or write it through here and we'll talk about it. I'll take some questions.
Since you don't see them in person until post op, you modify stuff for the mommy makeover?
So usually it's rare, but we can, okay? Usually with your picture evaluation and your questionnaire, I'm able to give a good recommendation that most of the time is the one that we keep. If you have a concern that's specific, sometimes people are like, yeah, but in the picture you can't tell this, that I'm pinching, or something very specific. You can always ask your coordinator to do a virtual or an in-person consultation before your pre-op day, okay? And that way we can talk specifically about a certain concern that you have. And of course, if you come on pre-op day and we're planning on doing the breast augmentation and you come here and you have grade 2 ptosis, the breasts are super droopy, I'm going to tell you this is not going to look good and we need to change your procedure, right? If that's the case, 100% I'm going to let you know in pre-op that something happened with the pre-op, you know, with the consultation and we need to change it. Again, it's very, very rare, but of course, if that's the case, we're going to do that. But if you want to add on something that you were thinking, for example, your arms, you were thinking about the arms and you wanted to wait until pre-op to ask me, that's fine. But remember that we're going to add 20% over the initial cost if you add it on the day of pre-op, because I have to get equipment, alter the schedule, and there are some things that we need to modify to add on that other procedure the day before.
When can we wear stage 1 faja?
So that's a very good question for mommy makeover and tummy tucks, okay? So the stage 1 for lipo cases only, lipo BBL, you're gonna wake up with, okay? And you're gonna wear it for 7 to 10 days, and that's when you switch to a stage 2. For mommy makeovers, it's different because you're gonna have 2 drains, so you're gonna be wearing a binder, okay? That's like a wraparound with a Velcro. So when you wake up, you're gonna have that on, and you're gonna wear that day and night until the drains come out. Once the drains come out is when you can switch to a faja, okay? Usually at that point, it's more than 7 to 10 days out, so you can start wearing your stage 2. Some people at that point are still very swollen and fit in the tight garment stage 2 and need to transition for a few days to a week or 2 with a stage 1. So it depends, okay? But the majority of people can switch from the binder to a stage 2.
Okay, I'm 3 weeks post-op and I still have 1 drain left. Can I take it out?
So send us a message to Clara. Usually at 3 weeks, I ask you to remove it, but I'm going to ask you for a picture. I'm going to ask you for some information regarding the amount that it's draining, the color of the drain, so we need a little bit more information, okay?
Do you have any before and after photos of male BBL?
I do, yes, I do. The best way to get those before and afters is you can fill in a virtual consultation form. That way a coordinator can be in contact with you and you can ask her to send you the before and afters. There's a HIPAA compliant or patient privacy compliant messaging system that we use. It's called Clara, and through Clara we can share those pictures. Awesome. Thank you. Oh, yes, no?
Yes. Can we wear... I'm not ready. We have 3 more questions.
No, I thought you were like this usually.
Okay.
When Willie goes like this, it's like it's done. I'm sorry.
Okay. No, this is the next one. I'm sorry.
Yeah, let's do it.
Can we wear a faja after drains
So
are out?
your faja, correct. So you're gonna be wearing the binder until the drains are out. Once the drains are out, you switch to a faja.
If we are traveling and planning on staying 10 to 14 days, do we have various post-ups? Scared to go home and take my own drains out.
Yes, definitely. So if you're staying longer than the 5 days post-op, that's even better. And yes, of course, we can see you as many times as needed. And when your drinks are ready to be removed, you can come over and we remove them, of course.
There's any vitamins do you recommend taking prior to surgery to prepare the body?
Yes. So when you schedule a surgery, you're going to get a call 45 days before your surgery date, and the pre-op department is going to go over what things you should stop, including nicotine, estrogen products, Adderall, or I forgot the name of the medication, but Adderall or stimulants is the word that I was looking for. Stimulants, you need to stop 30 days smoking nicotine products, okay? And at the same time, you need to start supplements 30 days before. So they'll go over specifically which ones, but it's iron, folic acid, vitamin C.
Okay, and the last one. Should I plan my trip for 7 days before heading back home? I have a 3 hour flight.
So a 3 hour flight is not that bad. It depends. I mean, you need to stay at least for a week. After that week mark, I'm going to see you on day 5. After I see you in that appointment, it's up to you. You're clear to go back home, and a 3 hour flight is not too long, so it's okay to fly back. But if you feel better staying one more week, that's completely up to you. And like I mentioned before, if you have drains and you want them to be removed here, you can stay a little bit longer and we can have them removed before you go back home.
Can we show you wish pictures on the pre-op?
Of course, I love it. Wish pics help a lot by telling me what you mean by whatever you're saying, okay? For example, I get a lot of, I want a natural look, but high, but full, but not that big, but okay. So what do you mean by all of that? This picture, okay. I like the way that this breast sit. I like the way the cleavage looks on this person. I like the way the volume looks with her back, right? And it's not gonna mean that you're gonna look like that, right? Our bodies are all different and we all heal differently. So even if I put the exact same implant and do the exact same lift on you that in another person, your body's going to heal differently and your results are going to be different, okay? So wish pics help a lot too, so we are on the same page of your goals, but also is very, and I'm going to go over what is realistic, what to expect realistically with your foundation, comparing it to those wish pics.
Okay, a few words, but quick. Can we book massages at Pure?
Yes, we have a massage therapist here. Her name is Jessica. She's awesome. But you have to schedule with her differently. It's not that you're going to come and she's going to see you, okay? You need to book the appointments with her. So the best way is through your coordinator. Writing through Claire, I'm interested in having some massages with her, and they can put you in schedule with her.
And the last one. Is the pain shot included in the Trifecta Mommy Makeover?
It's what?
The pain shot. I guess Exparol.
Okay, Exparol, yes. So the Exparol is not included in your quote usually. It depends on the coordinator that what you talk to her and what specifically was included. So if it is, it says it, okay? If it doesn't say it in your quote, it's not. It's an add-on, okay? So mention it to your coordinator that you're interested in, and they can tell you the pricing and add it if you want to. It is an extra cost. I use the Exparol for all of you guys that, if you don't know, Exparol is a local anesthetic that lasts for 72 hours, and it can be injected in the muscle and the incisions of the tummy tuck. So it's going to numb the muscle repair and the incisions for the first 3 days, which are the most painful. Okay, so I've seen a lot of my patients that get Exparol shot, they don't even need to use the Percocet and they're okay with Tylenol. So I think it's a very good add-on, especially if you want to try to avoid narcotics and help with the constipation part. So if you're interested, talk to your coordinator and she'll let you know how much is the price and how you can add it. Okay? Ahora sí, thank you so much, you guys, for joining. I hope this was helpful, and send me DMs if you think I didn't mention things that I should. What was your experience? And I'll see you next week with Tuesday tips, what to expect. of a different procedure. I'll see you next Tuesday.